Atrial fibrillation, or AFib as you've probably heard it, is a condition that affects the rhythm of your heart, causing irregular heartbeats. And according to the CDC, it's estimated 12 million people in the U.S. will be diagnosed with AFib in the next 6 years. So here to explain what you need to know about AFib is Dr. Matthew Kolek with Palm Beach Gardens Medical Center. Doctor, thank you so much for coming by.
Thank you,
I think a
Stephen.
lot of us have seen those commercials that talk about AFib, but you don't really know what it is. So as a part of this awareness month, just to explain to us first what AFib is.
Sure. Well, so Stephen, AFib, or atrial fibrillation, is the most common heart rhythm condition, or arrhythmia, in the United States. Somewhere around 12 million Americans have it now, and it's becoming more and more common as our population ages, and as there's just a greater awareness about AFib out there, and as technology allows us to earlier diagnose AFib.
And how is it diagnosed?
Well, usually it's diagnosed with an electrocardiogram, an EKG in the doctor's office, but I'm finding now more and more that patients are self-diagnosing with some of these wearable devices like smartwatches as well.
Interesting. Okay, yeah, so smartwatches now pick up your heartbeat.
Correct, yeah.
And tell us what happens if this goes untreated, if someone does not self-diagnose?
Well, it's very important that if patients are experiencing some of the symptoms of AFib, things like palpitations, where they feel a rapid or irregular heartbeat, or exercise intolerance, shortness of breath, fatigue, it's very important that they talk to their doctor and get diagnosed, because if it goes undiagnosed, of course, patients can experience symptoms which can lead to a decreased quality of life, but also AFib is a major risk factor for stroke. When your heart is in that rhythm, a blood clot can form in the left atrium, and then if it goes up to the brain, it can cause a stroke. And AFib, if it goes unchecked, can also lead to heart failure, where the ventricles, the bottom pumping chambers of the heart, weaken, and that can lead to further problems.
And right now, just for our viewers, we were looking at some risk factors there.
Yes.
So when we do these awareness months, we always like to check in to see if there are any new advancements in treatment. But talk to us about how AFib is being treated right now.
Sure. Well, Stephen, it's very important that patients with AFib see a cardiac electrophysiologist, a heart rhythm specialist, because the field of AFib treatment is changing and evolving so rapidly because of new technologies such as AI, because of new treatment options such as catheter ablation, a minimally invasive procedure that can very effectively treat AFib, especially if it's done early on in the disease course. So it's important that patients are aware of that information. Other things that are out there, new medications, new blood thinners that are very well tolerated. And for some folks that can't tolerate blood thinners, we sometimes recommend a Watchman procedure, a procedure that can take the place of taking blood thinners long term.
Okay, and if someone watching at home, lastly, if they just want to go about this in their everyday life to help prevent AFib, what should they do?
Sure, yeah. So the biggest risk factor for AFib is age, which of course we can't do much about, but there are modifiable risk factors, so things like poorly controlled high blood pressure, poorly controlled diabetes, obesity, excessive alcohol intake, and of course all those can be modified by the patient. And for more information about the risk factors, management, and as well as treatment options for AFib, I recommend patients visit our website, heartbeatdoctor.com, for more information.
Heartbeatdoctor.com. All right. Thank you so much for dropping by. We're going to make sure we put that on our website as well. If you want more information about AFib, you're just curious about everything we talked about, go to WPBF.com and search Understanding AFib. Sandra?
All right.